Hello everyone. This is our product for the DiaTech 2025. We have come up with DiaCornea. We are two students from AIMS New Delhi. My name is Janvi Banotra and I'm a third year student, and I'm working with Dhruv Advani, who is a second year student. So now to speak about the problem that we've decided to tackle, as we already know, there were 101 million cases of diabetes in India last year, and out of that, 50% do progress to neuropathy. Those further progress to diabetic foot diseases or amputations. Now, 85% of these amputations are preventable. But why do they still occur? It is primarily because of late diagnosis. So now the diagnosis cannot be made early because of a lack of early and sensitive screening tools. And even if there are sensitive screening tools present, they are expensive, they're inaccessible, and they require specialists. So, how have we decided to tackle this problem? We have created DiaCornea, which is a cost-effective, accurate screening and imaging device for early detection of small fiber neuropathy. So, before that, I'd like to shed some light onto small fiber neuropathy. So, basically, small fiber neuropathy is established as one of the earliest signs in the progression of diabetic foot disease. It occurs before the presentation of any clinical symptoms. So, we take scans of the cornea because it is one of the most densely innervated tissues in the body, and there is an abundance of A delta and C fibers. So, what is the technique that we're using? That is the same. We use the same principle as the corneal confocal microscope. Basically, there is a laser that's emitted from a light source. It penetrates the cornea. That light is reflected, and an image is generated of the neural structures in the eye. So, we managed to modify this device to create to create a new device that has significantly reduced the costs, and we've reduced the need for specialists by integrating it with AI. The impact that this will have is that it has certain features that will allow the device to be used in low resource settings with minimal training. And these features are that it allows early detection before the onset of symptoms, it is cost effective, and the AI integration with simple design will be very helpful.
If we talk about the stakeholders and their needs that need to be addressed, for diabetic patients, which are our primary stakeholder, they require early and painless detection methods that are non-invasive in nature. For healthcare workers, they require simple, actionable diagnostics, which allow them to easily and quickly diagnose patients without the requirement for much OPD time. If we talk about the government as a stakeholder, the government obviously wants a decrease in the healthcare burden on the country. And for investors, we provide marketable and scalable technology that creates a lucrative incentive for them. The buy-ins for these stakeholders include awareness camps, training workshops, pilot programs under the National Health Mission, and grants respectively. If we talk about the technical feasibility, first of all, we've greatly reduced the hardware costs of the screening technology by using laser diodes and galvanometer mirrors in place of resonance sensors and 670 nanometer lasers, which have reduced the cost from approximately 70 lakhs to just about 4 lakhs. If we talk about AI assistance, the integration of neural networks to help provide a provisional diagnosis will decrease the requirement of experts and therefore decrease the valuable usage of their time. Then there is edge computing. So Raspberry Pi will process data locally, and that will allow this device to function without the requirement for internet. Now, since we are integrating AI into this device, we will obviously need to validate the data that it is generating. So first of all, we've decided to use the AIMS dataset of CCM images. That is one of the largest datasets of CCM images of diabetic patients in India. We will also utilize the data that is available in open source libraries, and we plan to create a centralized, robust datasets with input from tertiary centers using CCM around the world. Now, there are, of course, several risks that are associated with a product like this. Some of them include low resolution images and AI model inaccuracies, but we've come up with specific strategies to mitigate these risks. Now, if we look at a comparative analysis of a lab-grade corneal confocal microscope versus our product DiaCornea, we find that all components of the hardware, whether it be the lens, the laser, the scanner, or the camera, all of them are much cheaper alternatives. So they are definitely less accurate and less precise, and less sensitive. However, they are good enough to function as screening tests, and the cost that it's reducing the cost by a huge amount, making it much more accessible for a variety of healthcare centers. So while it might not be the most accurate tool, it is definitely an apt first line screening tool. So if we look at the workflow, when a diabetic patient visits the clinic, a nurse, an optometrist, or a healthcare worker can examine the patient using DiaCornea. The images would be captured and fed into the neural network, and a provisional diagnosis would be made based on the AI. Now, this image can then be sent to a secondary or tertiary center for validation of diagnosis by specialists. If you look at the clinical feasibility based on the workflow and training, we can intervene early on with behavioral or pharmacotherapeutic modifications in order to prevent the progression and prevent the preventable amputations that are occurring. And if we look at the cost of the test for the patients, since the price of the device has been reduced by so much, we can decrease the price of the tests as well and bring it. We've envisioned a price of approximately rupees 400, which can further be subsidized by the government. Now, if we look at our market, based on our analysis, we have come to a serviceable, obtainable market of approximately 2,632 serviceable centers in India. This is based on the assumption that there are 8,775 centers that are going to be able to afford this device, and we've captured 30% of the market. The healthcare centers that we're envisioning as part of our SAM include the primary health, community health centers, secondary health centers, etc. Based on the market price of a 4 lakhs per unit, we've expected a revenue of rupees 106 crores. So these are our references. I would like to thank you for listening so patiently to our presentation. We believe that DiaCornea can have a wonderful impact on the world and save the lives of a number of patients. We hope you see the potential in this project. Thank you so much.
Thank you.